So welcome everybody. On behalf of the Health Action Alliance, I want to welcome you. It's just such an honor to be with you here today and learn from our great presenters that we have here to share with us about the impact of COVID-19 and the pandemic and what's happened in their rural communities. You know, it's often rural communities get talked about in a really perhaps overgeneralized way. And we're here today to talk as a group, as peers, to learn from one another and make sure to break down those silos. We'll get to hear a little bit today also from rural business leaders who are going to talk about how they've been thinking about and working to address health within their employee groups, as well as their communities. So we've got quite a bit to cover today, and I hope you'll join us in the chat, share who you're with, where you're coming in from, and any questions that you may have, and we'll try to tackle those as we go. So next slide, please. So here you'll see just a couple of logos. My name is Emily Yu, and I'm actually the Managing Director of Partnerships with the de Beaumont Foundation. And our foundation aims to strengthen public health infrastructure in America and in foster communities that are really going to help people achieve their best possible. We're really proud to be a founding partner of the Health Action Alliance, alongside the Ad Council, the Business Roundtable, CDC Foundation, and Robert Wood Johnson Foundation. And we're all brought together by Moderator. Together, the Health Alliance unlocks the power of business to create a healthier workforce and thriving communities. Next slide, please. So I think we can all agree that the COVID-19 pandemic has really highlighted the power of business and public health. When it comes together and works together to solve problems, it can be so much more effective than on their own. Driven by a desire to reopen safely, to revitalize the economy, businesses have joined forces with public health and community leaders on a scale that has been unprecedented, to not only share best practices, but also to coordinate strategies and develop new and innovative approaches to keep customers, employees, and residents healthy and safe. One reason that that's been possible is because across our country, no matter where you go, businesses are really trusted by their employees. In fact, nationally, employers are one of America's most trusted institutions. A majority of adults actually say that private should be involved in encouraging employees and consumers to get the COVID-19 vaccine. And 4 out of 5 people think employers have a responsibility to invest in the health and well-being of their local communities. Let's take a look on the next slide at what media is reporting on this. Local business leaders can be really powerful instruments for change. And we know that that's especially needed in rural communities today that have been hard hit by the pandemic. So this conversation about how businesses, and in particular women-owned businesses, can lead public health and vaccination efforts, we think is a timely one to have. 1 in 5 Americans lives and works in a rural community. And over the last several months, rural vaccination rates have actually lagged far behind urban vaccination rates. In fact, over the last couple of weeks, new state and local data has shown that rural counties are continuing to see significantly lower vaccination rates. Next slide, please. And here you can see in the analysis from our partners at the Daily Yonder, the pace of vaccinations has actually slowed, and the gap between urban and rural rates of vaccination has continued to grow. And as of October 7th, non-metropolitan vaccination rates have lagged behind metropolitan rates by 12 percentage points. Next slide, please. And so what's behind this gap? What's happening here? Well, you know, there is some thought behind what we can learn from the attitudes and behaviors and reflections from those in the rural communities. So let's look at some data. About 6 in 10 rural residents, compared to less than half of urban and suburban residents, say that getting vaccinated against COVID-19 is a personal choice. And the most frequently mentioned reason, about 19%, is feeling that vaccines are too new or that there's not enough information about the long-term effects. They may also question the effectiveness of vaccines. These comments might be familiar to you and things that you hear in your community. Rural residents are less likely to view the pandemic as a serious threat, either to the country or their families, as surveys show. More than 4 in 10 rural residents, about 44%, say that they think the news is quote, generally exaggerated the seriousness of the coronavirus. Rural residents, 40%, also say that they're less likely to be worried about themselves or their family members getting sick from COVID-19 compared to that of urban and suburban residents, who come in at 54% and 49% respectively. So let's look at some new information that's coming in on the next slide, please. While rural residents are less likely to be worried about COVID-19, as the survey data that we just saw on the previous slide showed, compared to their urban and suburban counterparts, as I just mentioned, the data also shows that rural communities are the hardest hit from COVID-19 and the Delta variant right now. So even in rural communities, residents may well know somebody who's become seriously ill or even died, unfortunately, of COVID-19. So this shows the top 10 counties in America that as of today have the highest number of COVID-19 cases per 100,000 residents. All 10 of these counties are predominantly in rural areas. And all 10 of these counties have vaccination rates that are well below the national average. Some of you today might be coming in from some of these counties as well and can share your perspectives. At Health Action Alliance, we're really curious to learn from you and hope today can be an opportunity to do so as well, and to know whether this information reflects what you're seeing on the ground and in your community, and also how groups like Health Action Alliance can actually help businesses in your community. Please feel free to drop in any comments during the chat as well. So next slide, please. So what can we do about this? How can we take action? So the Health Action Alliance, and again, I'm just here to sort of tee up today's conversation, but want to sort of show you and share with you some of the resources that we have to support rural communities and businesses. We have a suite of resources designed, and you can access these all at a website that will drop into the chat for you. And I think if you just click on a couple, it might animate the slide. There we go. Perfect. Thank you. And if you don't mind clicking it again, we can head over to the next slide. Perfect. Thank you. Could you? Perfect. Thanks. And on the next slide, I'm winding down my section, but if we could move to the next slide, I'll just talk a little bit. There we go. Perfect. I think we've seen a lot of numbers, a lot of data and stats that I've sort of thrown at you at the beginning, which obviously are no surprise for those of us who care about what's happening in rural communities today. But what is exciting here on this slide that I want to share with you before I turn it over to today's session moderator are a few stories that are launching today actually as part of the Ad Council and COVID Collaboration's ongoing efforts to reach rural Americans. The PSAs that you see here showcase the firsthand impact of COVID-19 and what the vaccines can do to address a lot of the challenges that we're facing today. They highlight personal experiences and stories from a wide variety of individuals, including two that we'll showcase today. Mary Jane is an owner of a local pharmacy in Texas, and Leslie Weaver is an organic farmer in Georgia. You can watch more stories like those from newlywed Evelyn Spencer in Mississippi and self-proclaimed sports mom Stephanie Bramlett in Georgia on YouTube with the link that we dropped into the chat. Whether motivated by their families, faith, communities, or other perspectives, each person here opens up about the diverse factors that went into their decisions to get educated about COVID-19 vaccines and ultimately get vaccinated themselves. So let's take a quick look at these two before we turn it over to our moderator for today.
I grew up sitting on the pharmacy counter reading the Wall Street Journal out loud to people, apparently. I didn't become a pharmacist. I married one.
It wasn't an accident that we moved home mere months before the virus.
It was important to study the science, to learn about the vaccine. We owed that responsibility to our community.
It was a while before we could roll out the vaccines.
The person first on the vaccine wait list wound up contracting the virus.
We called, we said, you're first to get scheduled. His wife said he's in the hospital.
He passed away only weeks later. You pray a lot. That is honestly what got us through it.
Our hospital is not set up for respirators. They were losing people before they transferred out. It was hard on this community.
It is frustrating when I see people spreading misinformation about the vaccine. We make sure that people have accurate information so they can make their own decision.
We share life together, see each other at the grocery store, go to church together. We're all a family.
This is CJ, the CEO of CJ's Produce. I'm the muscle, she's the brains.
It works.
My great-grandfather has owned the Brantley estate since the early 1950s. It has stayed in our family, and we're trying to make him proud.
We had plenty of food and love, and that's what got us where we are today.
Mama Tia is my grandmother. She was actually the first in the family to get vaccinated. I was afraid. Leslie was going to get the shot. I came up with every excuse anybody else would say. My grandmother got her shot. When I saw how strong she was, it was like, I'm a healthy young man. Why can't I?
Did I have reservations? Absolutely. But doing your research, weighing the options of what works best for you, getting the vaccination is helping your fellow brethren, regardless of how you may disagree with them.
CJ has been the motivation for a lot of things. He needs his father there to show him how to become a man. So I am fully vaccinated. I have somebody counting on me, so we made the leap.
Great, thank you so much. If you don't mind going to the next slide.
Sitting on the pharmacy.
Perfect, thanks. So those videos, I hope you'll agree with me, were incredibly powerful and set us up actually for the conversation we're about to have here today. We know that this work of rebuilding public health in rural communities isn't easy, but that is possible with patience and respect and understanding. We're really proud today to partner with Rural Assembly for the panel at Rural Women Everywhere and to bring out voices of women who are on the front lines of this pandemic and working at the intersection of business and public health. With that, I'd like to welcome and introduce our moderator for the session today, journalist and Mississippi Delta native, Aaliyah Wright. Aaliyah reports on rural affairs and leads race and equity coverage for Stateline. Previously, Aaliyah worked for Mississippi Today, a digital nonprofit newsroom covering K-12 education and government in the Mississippi Delta. She is a 2020 Mississippi Humanities Council Preserver of Mississippi Culture Award recipient and a 2019 Storyworks Theater Fellow, as well as the 2018 Educating Children in Mississippi Fellow at the Hechinger. Wright graduated from the Delta State University with a bachelor's in journalism and minors in communication and theater. So thank you, Aaliyah, on behalf of the Health Action Alliance for leading this important discussion. I'd love for you to pick it up from here.
Yeah, thank you so much, Emily, for that introduction. I am honored to moderate such an important discussion today. Before we dive in, let me introduce our esteemed list of panelists. First, we have Teresa Kittredge. She is the Executive Director of the 100 Rural Women. Teresa has spent 20 years as an elected officer of the Minnesota House of Representatives. Following her time in the legislature, she built the Washington, D.C. office of Rural Policy Research Institute and served as Director of National Policy Programs. She has over a decade of experience in leading and building national and international publishing businesses as an executive for Coughlin Companies and then as founder and president of the Minnesota Renewable Energy Marketplace. In 2014, Teresa returned to RUPRI as Vice President and Chief Operating Officer. In addition to her role at 100 Rural Women, Teresa serves on the Board of Directors for Northern Itasca Hospital District at Big Fort Valley Hospital in rural Minnesota. Next up, we have Jasmine Brooks. Her pronouns are she and they. She is the founder and owner of J Olive Wellness. Jasmine Brooks is a certified reproductive health, fertility, birth, and postpartum doula, lactation specialist, and the owner of J Olive Wellness. She serves Iowa and the Midwest. Jasmine believes in empowering Black, Indigenous, and women of color through community support and resources. Powered by the desire to address Black women's and infant maternal health, she encourages space for women to control their own narratives and share their own stories. Jasmine is the co-founder of the Iowa Black Doula Collective and program director for Nourish. Nourish is a community-led space that supports breastfeeding and providing human milk to infants through systemic change, education, peer-to-peer support, and community outreach to Black families in Iowa. She also organizes a national summer book club, Lotus Sisters, the Rural Black Doula Chronicles. She hosts the Being Olivia podcast to bring mental and spiritual wellness to the Black community. Jasmine is currently a PhD candidate in human development and family studies at Iowa State University. Her research focus is on Black maternal and infant health, Black mothering, and Black rural wellness. Next, we have Lisa Daniel Hollingshead, who is the owner of Fun Time Preschool. Lisa is a child care business owner, an educator based in rural Mississippi, my hometown, and is passionate about sharing her experience and is a vaccine advocate. Thank you so much for being here to be in community and space and have this conversation with me. I want to start off by asking, how are y'all doing? I feel like it's been such a tough year and a half, if I can speak for all of us. And I think it's necessary to do a temperature check. So, one, how are you doing? And two, I would love to hear if any of you have any reflections or thoughts about the two videos that the Ad Council presented. So I'll just start first, and then we can go around the virtual room. I'll say today I'm about a 7.5 and 8. Today has been a pretty busy day, and I'm doing pretty good, but I could be doing better. And in regards to the video, I think what resonated with me was just listening to the stories. I've heard similar anecdotes from lawmakers, public health officials, from family members, from friends, just about, misinformation, vaccine reservations, and even more so about how communities of color have been disproportionately impacted by COVID-19. And one of the things that a number of my family members and friends have shared with me, that once they did their own education and research and they saw that trusted family members went to get COVID vaccines, that helped them to then make their decisions about what they should do. So, Lisa, I'm going to come to you because you're my fellow Mississippian. How are you today, and any reflections or thoughts that you have after watching those videos? Lisa, you're on mute.
Okay, sorry. I just want to start off by saying that after hearing the bios and reading the information on the other panelists, I'm very honored to be able to be here today and learn from all of you guys. This is a thrill for me. How am I doing today? I'm very stressed, which seems to be the kind of the norm these days for us. I've got 26 children that are being quarantined right now because of a staff member testing positive last week. And so we're trying to get PCR test results to see when they're going to be able to come back to school. And so I'm stressed today, but I'm glad to be here with you guys. And one thing that really resonated with me through the stories, several points really hit home. But what I really could appreciate was the comment about educating people so they can make decisions for themselves. That's something that's very, very important to me, because I don't feel like I know I don't have a background in any medical capacity whatsoever. So I don't feel like it's my place to make a decision for other people in regards to getting the vaccine or not getting the vaccine. But what I do believe is that we've got to have correct information so that everybody can use that education and discuss things with their healthcare provider to make the decision that's right for them.
Teresa, what about you? How are you today, and any thoughts or reflections?
Yeah, I think I'm pretty good today. It's a beautiful fall sunny day, so that feels good. We sort of know what's around the corner in Minnesota with snow, but it's beautiful here today. And it's been extremely frustrating, and I'm so excited to learn from everybody on the panel today, your experiences. But I think it's really been a tough time with COVID, and I think just serving on a board of a hospital, it's really been difficult. We have experts that are sharing facts and expert information. And we have board members that, facts don't matter. So it's really an interesting piece with the videos, because it's really modeling the way and people sharing their stories. I think that's only the way that we're going to be able to get through some of this, because facts haven't been the case for so many people, which is tough, especially when they're coming from, extremely solid medical professionals. So that's probably been my biggest frustration, but I'm really glad to be here today and learn more and meet everybody. So.
Last but not least, Jasmine, how are you? Any thoughts?
Yes, thank you all for having me here. I will echo the same sentiments about, in general, how research and access to information is very critical. I reflect on what was said and think about the privilege I have of having a sister-in-law who's a pharmacist, and me being able to sit down and have a candid conversation with her about my worries and my concerns. Think about, why young people, just in the video, are more hesitant compared to, potentially their grandparents. I think that was interesting, and something to reflect on is, why our young people are more hesitant in taking the vaccine, and, the realities of a lot of us, particularly when thinking about the birth world, having to make some hard decisions that can have some deep implications that lead to, a loss of a loved one. So I think what was said was definitely resonating with me.
Thank y'all so much for sharing. Earlier, Emily talked about the progress in terms of COVID-19 vaccination rates. And, as I've mentioned, it has been a whirlwind of nearly 2 years. So what has that looked like for rural healthcare systems? We've been seeing a lot from different news outlets. I've even seen and talked to folks within my reporting. Hospital CEOs are concerned. It has been challenging to maintain the flow of patients with a limited number of beds. It has been a challenge to recruit and maintain staff. And some hospital CEOs have even had to figure out what services do we pause, reduce, or even eliminate because of what we're seeing with COVID. And in some cases, hospitals have had to utilize services from FEMA and the National Guard, and even asking for assistance for nursing students to be volunteers. It has been, so complex in what has been happening. And Teresa, I want to start with you. As a leader and on the board of a healthcare facility in rural Minnesota, how has your healthcare workers and community responded to COVID-19 vaccinations?
Yeah, that's quite the question. I just came on the board as COVID started, and we're sort of a unique situation. So just geographically, when you think of Minnesota, we're about 4 hours north of Minneapolis and about 90 miles south of the Canadian border. So we're rural, and we are a taxation district as a hospital. So we're a regional hospital. We cover 2 counties, but we're a taxation district. So we are elected on the ballot, and we can levy taxes to support our healthcare facility. So we have sort of a unique board. It's good and bad, because when we end in situations like this too, we're all elected, we're all independent, and our CEO's got a big job trying to figure out how to manage that board of elected officials. So when I thought about this question, here's what I thought: our staff, community, confusing. It's confusing, it's frustrating, stressful, exhausted, disappointed, conflicted, fearful. And oh my gosh, you guys, there are so many conspiracy theories spreading, not just in our community, but at board. And that's been really, really difficult to see, because, and that's what in my earlier comments, we have the research, we have the facts, and we have medical professionals. And that's really been one of the most difficult things I've seen. So I think staff is really conflicted. Also, there's all these fears about, oh my gosh, if we mandate, then, we're going to lose workers. Well, geez, we're losing them now, because our infection rate 2 weeks ago, we were one of the highest infection rates in our county, in the state. And if we go back to last spring with COVID, we were one of the few systems, 21, I think, nursing homes in the state that did not have a COVID outbreak, and that was us. And now it's totally turned on its head, and all of a sudden we're exploding with infection rates. So I just think, when I think about our community and our healthcare, I mean, healthcare workers, I've been asked by community members, when are you guys going to do the right thing and step up and make sure I can feel safe in my medical facility? So there's a lot of conflict within the community, and there's a lot of conflict within staff, and it is chaos, but all you can do is try and do the right thing, listen to people, and raise the issues at a board level, as far as my experience has been.
And I know you're wearing two hats here, board member, but also ED of 100 Rule Women. What has the experience been like for some of the women leaders, and what would you say are some of the challenges that they've endured?
Oh my gosh, I know that's such a good question. We've been in the process of doing 100 meetings across the state, and we've got 50 done that we started this spring, and we did them all virtual, and because of COVID. And what we really see with leaders, and this won't shock you because I know we're all going through the same thing, but this COVID, the virus has really highlighted the immense pressure that's on women to take care of family, take care of your professional life, balance everything. We had such a big mass exodus of women from the workforce during COVID because they had to educate their kids, all those pieces. I think broadband was another huge thing that women were struggling with. I have to drive my kids to the town hall outside so they can jump on Wi-Fi to do their homework. So a lot of those issues came up, but it just really showed the disproportionate pressure on women to manage everything. And I think one of the things that we learned from all the women that we met, and that was what it was all about, what can we do to better support each other, and those strategies, was meeting virtually removes so many barriers for a woman for a variety of reasons. Everything from driving somewhere to having money to put gas in your car to balancing all your duties. So that was a huge thing that came up. And I think what we're hearing from women now is, as we are supposedly coming out of COVID, which we aren't here, we're sort of going backwards, so that things are starting to flip back to the way they were. And it's like, how do we take the good from COVID so we can balance our lives better? I think that's been a big piece of what we heard from women as far as COVID, and worrying about their children in school. And when you think about school boards in our state, a lot of women serve on school boards, and oh my gosh, it's brutal, it's ugly, and it's really difficult. So we need more women serving in positions. We need to figure out how to better support them. And I think COVID has put immense pressure on people to not want to even serve in office. So sorry, that was a soliloquy, but that is really what we were hearing this summer from people.
Wow, thank you. I want to go to Jasmine and Lisa. You both are small business owners and have been working on the front lines in both childbirth and childcare work, two very important sectors. In what ways have the pandemic affected your businesses? Jasmine, I want to go to you first, and then I'll go to you, Lisa.
Yes, thank you. I have a list. Most of the list, right, when you think in hindsight, is giving me a better outreach for people. I think when we went, we're all home and not able to go outside. I think it, made us have some unique ways of connecting with people. I think it also posed the challenges of technology. Like was mentioned before, that issues of Wi-Fi and what does it look like for everyone to be online and doing video and those type of things. But I think some big things I've had to be mindful of. I end up having to put a web page up to specifically talk about my protocols for safety. I'm in folks' home, I'm in their birth space. There's forever changes in the hospital system. And so what does those services look like, and how are they changing, and how am I making sure I'm safe? So I had to make sure, like, I did a lot of my homework around the vaccination. Also looking at how currently the rates of like education and check-ins with clients have like risen. Normally I do about 3 prenatal appointments with families. It's pretty common with doulas. But I've had to have more check-ins just for mental health reasons, changes in relationships, even changes in, household income to job satisfaction, all these things that, are pretty common stressors have risen, exponentially. I also think about in Iowa, we have, rural and urban locations. And oftentimes, for example, Des Moines can be surrounded by very rural communities. So it's very unique, presents unique challenges, right, of being able to connect. I feel with urban spaces, they're more honed in a community where rural folks are very isolated. Relationships are important, trust is important. And so having to build connections differently and being, using government agencies to reach out, particularly here in Iowa, some of these smaller counties are not trusting of doulas. And we know that doulas have great potential and impact on the birth experience, right? Whether it be to lower maternal morbidity and infant death, to having a positive birth experience, but a lot of these counties are not welcoming to us. And so we're having to find new ways, again, using government agencies to help with those things. I think too, that leads into my last point of using grants. Grants have been a huge way of building support because we don't have a lot of families that have access or the financial capabilities of paying for doula services. And that includes childbirth education, lactation support, postpartum, right? If they had a miscarriage, oftentimes some of these resources are not free or accessible because there's a low rate of folks having those types of services that are provided, right? So they're having to often go private in order to get to some of these things. And so we're using grants to help with addressing those things and building more doula networks so that the families can have more support so they're not being turned away and left on their own. So those are kind of the things we've been kind of thinking through and practicing on.
Yeah, I'm glad you mentioned addressing the issue of accessibility and availability. That's not something I've been able to report on so far, but I know that has been a huge issue even before the pandemic. So thank you for bringing that up. Lisa, how has the pandemic affected your businesses?
Yeah, so I just want to kind of piggyback off what Jasmine said, because a lot of the things that she's dealing with in her industry, we're dealing with in childcare as well. We're having to rely on grants to sustain our business. We're having to ensure initially researching safety protocol for our staff to come in the building, for our children to come in the building, so that we're protecting children and we're protecting our staff. We're having to find alternative ways of building connections with families. When the pandemic first hit, our enrollment dropped tremendously. And we were able to be certified as an emergency childcare provider so that essential employees could enroll their children with us. What that meant, though, was that we have new families whose centers have closed down and they're coming to us, but they can't come in the building. So they don't have really an idea. I mean, we do have video cameras in our classroom so they can log in and see what their child is doing. But we're not having face-to-face contact with their direct child's provider, care provider. And so that is a struggle, and it is a stress on families to go and leave your child with someone that you don't really feel like you've got that connection with. We are seeing now our enrollment has turned around, and now a lot of centers in our area have closed, and they're not going to be able to reopen because of the financial impacts of the pandemic. And even someone mentioned earlier about children, I think it was Emily talking about children being at home with family, the majority of that being women in providing care, and some trying to work from home. And so what we're seeing now with children that we're enrolling 20 months later, children have been at home with a family member who a lot of the times it's working from home, and there's a very large difference in a child's development when we have a care provider at home who is focused on caring for that children and providing interactions and language development and experiences and exposure to materials that grow and develop that whole child, as opposed to I'm at home with you and we're in the same room, but I'm working. And so now we're dealing with having to try to catch children up, and seen a huge decrease in social emotional development in our children that have been at home, as far as being able to regulate their own emotions and regain control of a situation after they become upset. Financially, we have had to rely on grants and government incentives and funding to stay open. When we have to quarantine because of a teacher testing positive or a child testing positive, those children have to go home, but our overhead remains the same. And being a private industry, once those PPP funds run out, then that's all I got. And so I still have to pay the lights and the insurance and all of those other fixed costs that don't change, because in this case, 25 children have been quarantined since last Wednesday. And so we've been giving family tuition vouchers to give them an opportunity to take a little bit off of their tuition. That's how we could manage the budget without just saying, okay, you all get this week free. We couldn't take that hit at one time. But we've given out, tens of thousands of dollars in childcare vouchers, upwards of $30,000 in childcare vouchers just in July and August and September, 3 months. So financially, things have just been a huge burden. And then, just the overall quality of our program. We are so focused on safety, health and safety, which has always been a priority, but COVID just amps that up times 100. And so field trips we have had to be canceled. We're not able to have guest speakers come in. We did community helpers in September, and we normally go to the post office and go to the library, and we have a police officer come in and talk to the children, and we go to the fire station and we see the water out of the fire truck. And so all of those experiences that mold children's lives, we've not been able to do. So we've been able to do some things virtually to kind of substitute in that capacity. But it's not the same. And I don't believe the benefit for the children is the same. So basically, we took everything that we had worked on and had learned for the past, 19 years. And then since we opened in 2000, and we threw it all out the window, and we've just started all over. And we're just kind of reinventing the wheel, and quite honestly, trying to have enough staff in the building to take care of the children so that we stay in ratio with childcare provider to the number of children that are present. That has been just a huge obstacle that I know everyone is facing, a staffing shortage. But it's not like, and I don't want to diminish any other industry, but I'm just thinking of like a restaurant, if my coworker doesn't come in, then I may just have to wait on some extra tables, or maybe we just have a longer wait for people to get seated. But like in our industry, I can't put children in the classroom without a teacher. So it's definitely been a rough road, and we just keep pressing on every day. Let's see. And I think that's about all the points that I had made notes of.
Okay. I want to do a quick follow-up for both you and Jasmine. You mentioned, altering services, taking on additional responsibility and workloads, having to do additional check-ins for the mental well-being of your families and your clients. Talk a little bit more about how the pandemic has affected your family's clients and the communities that you served. Lisa, let's go to you, and then we'll go to Jasmine.
So our families, I think, are facing what families across the country are facing, and that's isolation. And, you know, as humans, we thrive on, like Jasmine said, that connection with others. And so I believe mentally, we are seeing a huge change in the mental health of our children. We've actually had to have on contract for outside resourcing a mental health specialist that we can call and ask questions, and we can, you know, get information from in regards to how to help this particular child or this particular classroom. So it's definitely had a negative impact on our community as a whole, just mentally, and then as our children and their social emotional development, we've seen a huge decrease in where they are developmentally speaking, which we go by developmental milestones. And so when you look at 12 months, a child should be able to do this list of things or somewhere in that nature. And then, you know, we're seeing children that they're not there. And so we're at 18 months and we're still not mastering the things that 12-month-olds should be able to do. And so tracking that data and trying to stay on top of that and put interventions in place has just added a whole nother layer to the responsibilities that we have to our families.
Jasmine, what about you? What are you seeing as it relates to how the pandemic has affected your clients?
Yeah, so I actually published an article about this last year. So what we're seeing right now is some compounding factors, right? Not only the pandemic, but like the social unrest, the political climate, their own local communities and their responses from the state level. You're seeing, particularly here in Iowa, we're seeing just an infection, right? And how that looks is there are already symptoms of disproportionate impacts around health in Black and Brown communities. So with COVID and all these things that I mentioned, on top of that, you're seeing additional pressures and impacts and influences on how folks have chosen to navigate healthcare, how they've chosen to decide where to give birth, who watches their child, their connection to their community, the jobs that they're choosing to stay in or change out of. So all these things we're seeing as something that they're just having to deal with on a day-to-day basis. They choose, you know, often meaning our Black families are choosing to be with each other because living through this time in isolation is warfare. Like it's an internal strife that they're having to deal with on their own. And we already have challenges of folks getting to mental health services or mental health services being culture responsive and trauma informed. So I think they've been resilient. I talk about like not looking at it from a deficit model of these are the things they don't have. Black folks have been resilient throughout history. And so they're finding traditional ways and communal ways of managing and handling a lot of these things. So, and that means, you know, seeking doulas, seeking Black services or Black identified services so they can get a little bit more support and engagement as they're building their families into postpartum, those types of things. But I think from the community side, we're just seeing sometimes a hopelessness, right, of folks who are supposed to be giving services. They don't see themselves in the work or may question the ways in which they navigate working with Black and Brown families. So folks like myself have had to be an encouragement, be an educator, bringing in, you know, innovative services like Nourish so that the families aren't left behind, because oftentimes they will be, right? We talked about the disproportionate impact. So yeah, long-winded answer, but that's just the realities. It isn't just COVID for us.
I want to pivot the conversation a little bit back to vaccinations. Lisa, you have been a strong and vocal advocate in your community for vaccinations. And I believe you were featured in the piece where you talked about employees who didn't want to get vaccinated. Can you talk a little bit more about what that experience was like for you and how has your advocacy affected your business?
Yes, thank you. So I touched a little bit earlier that, like, I don't have any medical background. I don't have any schooling in any medical capacity whatsoever. And so I have to work really hard to read the research and find the truth in the information. And that takes time, and it takes, meeting with people and asking questions and trying to understand it, and then going back and reviewing and trying to make more sense out of it and that kind of thing. And so we've spent a lot of time doing that. And when the Delta variant hit Mississippi, it hit our community very hard. In July, we had probably over 100 children throughout the first 2.5 weeks that we had to quarantine from our program. And so we were thinking, okay, we've got to do something to sort of slow the spread and figure out what we can do to keep our children safe, but also to keep our staff members safe. And so just started doing some intense research on the vaccine and seeking out some tools to use with our staff that we could have personal conversations with them. Also feedback from our families when their child's quarantined. They're asking, are our teachers vaccinated? We only want our child in a classroom with teachers who are vaccinated. We're protecting our child at home. We're vaccinated. We don't go out in public. We don't take the child to the grocery store. The only thing we do is come to school, and we want to feel that same security from you and your program. And I want to be able to give them that. The flip side of that is, though, that I've had 3 fully vaccinated staff who've tested positive for COVID. And that's the children that are on quarantine now. The teacher that was tested and positive last Wednesday, she's fully vaccinated. No underlying health issues. And she's, late 20s, a model of health. Here she has COVID. So we are doing what we can to have conversations and strike conversations with staff members. We started off doing those in small groups, and then individually and one-on-one. I just asked them to come in my office and I would just like some feedback from you on your personal beliefs and where you stand on this and how you feel about the vaccine. And that has increased our vaccine rate tremendously. Our total number of employees, we were around 82, 83. And I pulled a report today just so I would have some accurate data for this meeting. And we were at 105 currently employed. So that puts us under the president's mandate, that everybody has to be vaccinated. And of course, that number changes. It's a fluid number. It doesn't always stay 105. But at that point in July, we were at about a 10% vaccination rate of our staff, or that staff that had reported vaccination to us. And by that, I mean, they've provided proof with giving us their cards. We did some work with our attorney because there's some fine lines, I guess, you have to kind of walk around. And we could incentivize getting the vaccine, but it couldn't be perceived as being coercive, so that we were forcing our employees to be vaccinated. And so we talked through some strategies and worked some things out with that. And then we put in an incentive for employees to be vaccinated by the end of September. And I guess about a month, 5 weeks ago, I kind of sat down with everybody that had not turned in cards, and we had conversations, and we talked about individually, like what is your decision based on? And then when I could, I would provide some information for them just to take and read. I'm not trying to convince anybody one way or the other what to do for your safety. I'm just telling you, these are some facts that I believe it's accurate research. So take this, read over it, discuss it with your healthcare provider, and make your own decisions. And as of today, we only have 8 staff members who are not fully vaccinated, and we have 4 that have had COVID recently, and they have to wait for their 90 days before their doctor will tell them to get the vaccine. So they technically still have antibodies, and so I feel safe in that. And once the doctor gives them the go ahead, then they will be getting their vaccine, which will put us well over 90% vaccination rate. And I'm very excited about that. We've also implemented with our new hires that we want a copy of your vaccine card before you can start training. And so I feel like that's the way that I can increase the vaccination rate, so that when we hire you and you get your paperwork and you get your background check in and all of those things, before you can come in the building to start training, I need a copy that you've had at least one vaccine. And so we've been able to do that with all of our new hires over the last, 6-8 months. Weeks, I'm sorry, 6-8 weeks. So that has helped tremendously as well. And so we've just got, like I said, 8 that are not vaccinated. And I think 3 of those said that if it was required, they would get vaccinated. And so initially, when I did the piece talking about vaccine mandates and the response to the president and that kind of thing, I was very nervous because staffing is such an issue in our industry, and staffing the building and staying in ratio and ensuring the children have the highest quality interactions and supervision, and health and safety while they're there. And so I was nervous that I would lose like 30% of my staff. And I feel like if I had just come out and said, this is what I say, and you have to do it by this day or else, I feel like we would have had more pushback. But I feel like the way that we approached it with personal conversations, I feel like that was very helpful in getting us to the point where we are today with, really very close to 90% today. And after these 4 come on and get theirs, once the doctor clears them, then we'll be well over 90%. So I don't want anybody to have any negative repercussions from having a vaccine that I've said you have to get. I don't want that on my conscience, but I also want you to have the knowledge and the information that you need to make the best decision for yourself. And so I feel like we've worked really, really hard to get where we are. And I think for the most part, we've been pretty successful. Nobody has resigned. We've not lost any employees over all of the conversations that we've had, and requesting for copies of their cards and things like that. It's been a very positive response from our staff, and then for our families as well. They want, when I can email them and say, your child, every teacher that works in your child's classroom has been vaccinated. I can't tell them who's not vaccinated, but I can tell them that the staff working with their direct child has been vaccinated. And so that makes the families feel much safer about sending their child away from home.
That sounds like a lot of building trust, having a lot of care and compassion in the conversations that you're having. Teresa or Jasmine, do you have any thoughts as it relates to ways that you have approached conversation with folks about COVID-19 vaccinations that have turned out to be successful? I know there's been a lot of, conflicting views on it. There's been a lot of, perspectives, but Lisa's example of, providing the education, the resources, and taking time has allowed her, in addition to a lot of other things she mentioned, has allowed her to see, an increase in vaccination rates. I just wanted to know if y'all had any thoughts as it pertains to ways to approach the conversation for folks who may be on the fence.
Yeah, I can go. I would say, particularly thinking about birthing folks, they are pregnant and oftentimes are not getting the vaccine until later, if not at all. And so I always first honor their fears. I ask them about their health. I ask them, what is important to them, what makes things challenging to make these decisions. Obviously offering them some education. I'm a scholar, so I can bring up a lot of research around breast milk and how COVID is showing up in the birth space too, with babies, like to the vaccine and how those are kind of showing up in breast milk as well. So I think I'm kind of lucky in that instance of having access to a lot of these articles, because a lot of these articles are not accessible. So that's a whole other conversation. But I would say I first honor and talk with and do a lot of listening, because it is real. Folks are worried, particularly like with my fertility clients, very worried about not being able to have children. Like I've never, so just full disclosure, I've never gotten a flu shot. It is not something that has been common in my family. My part of my family was born here, and another part of my family was born in Belize, but neither one side have said, go get the flu shot. Like that has not been a conversation, nor has ever been in interest to me. I'm fairly healthy, given that there's, other health concerns in my family, but it's not rare. So I think it's easy for me to, understand hesitancy, because, that's part of my story.
Teresa, I don't mean to put you on the spot here, but any thoughts that you have?
Yeah, I think it's been quite a process, and I think being on a hospital board and dealing with staff that are part of a medical facility, that provide care to outside patients has been it's been a lot of education, even though people are medical professionals, and it's dispelling myths of misinformation going around, and there's been a lot of one-on-ones. I know our CEO has been busy with staff communications, and our medical director has offered to meet with anyone to sit down and talk and try, show them the evidence, show them the information that he has. And he's tried to do that with our board, and has not been real successful with our board. So a good example with our board of directors, there's 13 of us, so we're all elected 4-year terms. And there's not enough votes on the board to support a vaccine mandate, even though we are an independent system, so we're on our own. The big systems in Minnesota have moved on their own to mandate vaccination. So we are waiting on the federal government to come forward because we receive Medicaid and Medicare funding. I think we've given people a lot of education, a lot of facts, a lot of information of why it's important to be vaccinated. So maybe you're not worried about yourself, but it's about others and about people that you serve in the hospital. So I really see that's where we're at. I made a motion last month to move on the vaccine, and there's not support on the board to do that. But I feel as an elected official, I have a responsibility that we provide our staff and our patients and community members a safe environment. So that's the way I've dealt with it, and I've offered to talk to anybody. But I do think what we've really tried to do at a hospital level is really have our medical professionals be the ones that really share fact, evidence-based information to influence our employees to think broader than some of the rumors or conspiracies that they're hearing in the community too, which have been prevalent.
A couple more questions, and then we'll take some questions from the audience if you have any. Jasmine, back to you. As a birth worker, what have been some of the challenges and concerns that you have been experiencing with expecting mothers during the pandemic? And has vaccinations played a role in you being able to gain new clients and keep your old ones? Yeah, when I looked at the questions, I had to think for myself, have any of my clients asked me if I'm vaccinated? And I feel like only one has asked, and they were a non-Black client. So then I had to think to myself, what does that mean? Because it hasn't been brought up. And I think that just speaks to our conversation today, right? But as far as expectant mothers, I think as mentioned before, the isolation is huge. I don't know for folks who've had children, I haven't had children yet, but it's a beautiful time in your life that you want to share through either, folks visiting you, to having a baby shower, to having family over when the baby's born. Those things are not available, right? Those things are, questionable. A lot of my families have been very innovative. They've done drive-by baby showers, so they'll be outside in their front lawn, and social distancing, obviously, and showing their child to their families, because that's important. I think it's a very communal thing that we do. And so just a lot of, again, I talk about resilience. They've been very resilient and resourceful. Something that has been, I feel, will potentially have repercussions is induction rates. So something that we published last year was, the potential impacts of inductions on Black maternal care, and maternal care in general. Because, I think part of the issue with the response of the pandemic is, if we induce, then that limits their, time in the hospital, but we know that those things are actually the reverse. It often exposes you to certain things such as infections, potential readmission, to post-traumatic, postpartum depression, and PMAD. So, and also just any repercussions when it comes to infant health. And I think the other piece too of it is we think about the connection of like lactation. We know that milk is medicine, and there's a lot of commonalities of providing human milk to a child early in their life that would help prevent certain diseases such as diabetes, cancer. And so a lot of our families don't have access to those things, or may not be able to get in-home support because of the pandemic. There's been, when the pandemic first started, childbirth classes went virtual, and a lot of times they saw a decline in attendance. Childbirth classes are very intense and time intense, lots of information that's overwhelming. So you think about like the changes happening in your own life. If you have littles already, then you're having to sit down for maybe an hour, 2 hours to learn about, epidurals. Like your brain is not going to see that as a necessity at the time. So this is why, folks are wanting doulas even more. So I've seen a rise in clients because of that. I thought it was going to be a decline, but it's the reverse. And I also see a rise in folks wanting culturally responsive and trauma-informed, because I think with the pandemic, with having to make some choices around the vaccination, and if you are then exposed or having had loss in your family, there's just, again, compounding effects that these families are experiencing and having to navigate. And there's limited mental health services. I believe there was a time where insurances did allow for virtual, and that was backed off. And now virtual isn't part of some insurance plans anymore, and they're having to go in person. So what decision does that look like, right? To have to be forced to go back in person, particularly in Iowa when it's not the mask isn't mandated, vaccinations aren't mandated. And folks are just, very concerned, right? And I'm putting that lightly and loosely because, again, we're having to think about other things too. So I don't know, I think it's interesting to think about for the future, like what that looks like what does that impact look like? But yeah, that's what I'm thinking.
My last question, and then we'll bring in audience questions. This has been a pleasure to have this conversation with y'all. Each of you have shared different experiences through different lenses in rural communities across the country. Can you just share with the audience how your business, organization, or community have responded to vaccinations, if you want to expound there, responding to forthcoming vaccinations for children, and how officials, both business and public health can help to bring vaccination rates up in your communities. And who wants to go? Let's go with Teresa, Lisa, and then Jasmine.
Yeah, that's a big question. I think when I think about just stovepipes, when I think about the hospital board that I serve on, we're waiting for guidance from the federal government on vaccine mandates and trying to get people better educated so we can be more proactive with that. One of the things I guess I touched on earlier that I really want to raise is school boards. I just think, we have got these school board members have such pressure and they're being bullied and harassed, and oh my gosh, it's just been a really difficult experience for people. And we have people protesting outside of elementary schools, and I just think that, as we all know, we do have vaccinated people testing positive, and it's because we don't have enough people vaccinated. So until we get that vaccination rate up, we're going to continue to have spread, and we're going to continue to mutate. So I just think of all these different things that are going around with school boards and them trying to figure out how do we keep our staff and our children safe and still, address, some of the loud voices and strong voices in our community. But I think net in the end, when I think about vaccination, it goes back to what I just said, that until we have a higher vaccination rate, it's not going to be over. It's going to continue to spread. It's just going to continue people in difficult situations. I'm not comfortable going into our medical facility. I'm not comfortable with that, not knowing if people are vaccinated or not. And to Lisa's point, it puts our staff in really tough situation too, because, with HIPAA and all those other pieces, who's vaccinated, who's not. So that was sort of a roundabout way of hitting your thing on. I just think until we get that vaccination rate up, we're just going to continue to be spinning and spreading. So my hope is from the hospital board side is that the federal government comes on with guidance soon, so we can get our hospital and our senior care as safe environments for our staff, community, and patients. So.
I agree with what you said, Teresa. I think education is going to be the key to leading to higher vaccination rates, which is going to be the key to decreasing the mutations, which seem to get stronger with each mutation, and that the virus takes on different forms and affects different body parts and different populations and different, regardless of underlying health conditions and all of those things. It's attacking different organs, and it just presents so differently. I agree with everything that you just said, and I just want to touch just a little bit on what is looking like a vaccine that's going to be approved for school-age children ages 5 to 12 very quickly, and then after the first of the year, possibly even, for toddlers and preschoolers, a vaccine. And I'm kind of back where I was with the staff, in that I don't want to tell families that they have to inject something into their child it's very, very new, and like there's no way to know long-term effects down the road or potential side effects, because we haven't studied it long enough to have all of that information. But at the same time, I want every child in my facilities to be safe. And so, there's a balancing act and trying to, protect children and staff, and also promote health and wellness in the community. And I think it's just an ongoing situation. We're just going to have to continually, and I say this all the time to my staff, is we're teachers, but we're also lifelong learners. And so we're continually researching and learning new ways to interact with children and respond to particular behaviors. And then COVID has just kind of sucked all of that right up in that we're having to continually research and review and read and learn and ask questions and talk to people and gather information so that we can make the most informed decisions. And I think for leaders, whether business leaders or political leaders or public health officials, we've got to do our part in expanding the education opportunities for our local communities, and especially those of us that are located in rural areas where, like we said, a lot of people are staying within their little community groups, and that's all the communication they have. I know somebody mentioned earlier about trying to get broadband up and internet and people having to go, to a public facility so their child can have Wi-Fi to do homework while they're doing virtual learning. We've got all of those challenges that people all over the country are facing, and we've got to be able to reach them and educate them, and so that we can keep moving forward. I'm not even sure if I answered your question, Aaliyah. I feel like I just got on a soapbox and went to rambling.
No, you're fine. Jasmine, any thoughts you want to add?
Yeah, I just want to add two things. I think it's going to be interesting in the response of, the vaccine for our littles. And I also think, when we consider what needs to change, I think we need to change how we're responding to folks with pre-existing conditions, as well as our service industry, folks who are having to work. Think about our labor force and what are they needing? Because if we're going to stop this from spreading, we need to address the vulnerable populations, right? This is not going to end. I think obviously mandates would be great, but I think about my state fighting that. I am fairly sure if a federal mandate comes down that our state is going to fight that because they fought everything else that we've been doing. And so, I wonder the ways in which our public health departments are connecting with communities. So for example, here, I thought it was interesting that they partnered with Black businesses to help in giving the vaccines to our communities, and continuing things like that, because I think it provides connection. We're all about trust. I think for the historical, there's so much history with the medical field and Black bodies that we are not reckoning with. And this is the response of that, right? We're the reason why we have so many medical advancements, because we were the ones being experimented on, right? So post-slavery trauma is real. We are 4 generations from it. So to assume that it does not live today really sets a precedence, right? We need to be mindful about how those things carry forward, because we're going to continue to see vulnerable populations, not just Black. Think about folks with disabilities, pre-existing conditions, women, children, right, that are having to have issues. And I also want to bring up the fact that I read an article about the high suicide rates of folks who are living with the effects of having COVID. So let's talk about that, right? If folks are committing suicide after having COVID and experiencing long-term symptoms, that shows an issue that we have with disability and ability in our country, right? So having to talk more about that, think about ways to address it, and centering those people's experiences in any initiatives, projects, grants. I don't know how many times agencies have applied for grants on our behalf without our knowledge. Those things are not helpful. Those things are harmful. And when thinking about being being part of a historically marginalized community, it is very, very important to center us. And that means bringing us to the table, asking us about our opinions, listening to our experiences. I don't know why people are so afraid of focus groups. Like, people want to talk, people want to share, and that's going to get you way more information than spinning your wheels in mud and assuming that, you know, a group of, you know, X people, homogenous people, are going to be able to address an experience of folks that are different from them. It drives me crazy to sit in rooms like that. And I'm like, you can't make a decision about Black people when you're not Black, right? Like, or brown people when you're not brown, or folks who are migrants and you're not migrant, right? Like, there is no way that you're going to be able to have enough cultural response, not competency, response, to be able to respond. So folks who are in positions, leadership positions, look around the table. If everyone around the table looks like you, that's a problem, right? Like, there's no way for us to fix this for everyone if we're all the same people sitting at a table. It's impossible. So those are my 2 cents.
Thank y'all. We have a question from an audience member. The question is, do any of you have a support network of colleagues, either regionally or around the country, who are doing similar work, with whom you could share among yourselves ideas that work for you, look for best practices, share results of your own independent scientific research, etc., and generally support each other? Whoever has thoughts or would like to respond to this question, I'll allow you to go ahead. I won't pick.
Well, this is Teresa. I can jump in. Yeah, we have a pretty strong hospital association in Minnesota, and I'm a new board member, so I have a big learning curve, but it's really been helpful to me to be part of the training, part of their presentations, and to be part of a cohort so I can bounce things off. Also, there's I've got some amazing board members that have served a long time. Our board chair's a doc, and I feel very comfortable asking questions and trying to get information from them. So yeah, those support networks are key to like surviving, because I think sometimes you just like, oh my gosh, am I ever going to get through this? So that's our mind.
I can't see Jasmine, so I'm not sure if she's wanting to go or not, but I have a couple of groups that I'm in that are national and that are owners and directors, where we can share ideas and sort of lean on each other and provide support to each other. And then I have a local group as well. And previously, but prior to the pandemic, we would just communicate via telephone or email. If someone had a question, they would reach out to me and say, hey, Lisa, what are you doing about such and such? But due to the pandemic, we've created a group where we're all in that together, and everybody posts and shares experiences. And it's not so much anymore just questions directed toward, say, hey, Lisa, how are you handling this? Or, hey, Lisa, this is what happened. Who has to quarantine? And I'm just like, I'm not the expert on this, but we did write a COVID policy manual for our program. And so I was just like, okay, well, this is what our policy says that we do in this situation. But now that everybody has kind of gotten to the point where they have policies and procedures in place to respond to exposures and positive cases and things like that, now we're able to just share and sort of collaborate, even just on things like pay rates. The other day, somebody reached out and said, hey, what are y'all paying new hires? Because I can't get anybody to work anymore, for a little over minimum wage. And I'm like, oh, girl, we are way past minimum wage. But once those federal programs run out, I'm not sure what we're going to do at that point. But right now, we've got to keep the doors open. So, but yes, those support groups where we can rely on each other and share information are extremely helpful.
So yes, I'm part of the National Black Doula Association. I'm one of their ambassadors, and we hold a monthly peer review session. So we just get to talk and connect. Often the vaccine COVID gets brought up because, particularly for newer doulas, they're having to navigate this environment. And, that's not part of our curriculum is, pandemics. It should be now, but it's not currently. I think the other piece too is I've been fortunate enough in the academic space to connect with birth workers. So not just like doulas that do birth, but like people in general who support families, connect with them either through institutions. So we go to conferences virtually, or we're part of research groups. So they put us into pods where, we're sharing our experiences. This was early on during the beginning stages of COVID, sharing our experiences and being able to share resources and practices that, other folks across the country and even the world have had to implement within their business, within their scope of practice, those types of things. So I've been fortunate, being able to connect those things to bring to then Iowa, right? Because I think there was a lag in the way in which we're responding because we weren't sure about how, particularly the hospitals were allowing us in or not. There was a moment where we thought they wouldn't, and then things changed. So thankfully, I've been able to be at all of my births. And are very grateful and appreciative of folks like the Central Iowa Doula Association because of their relationships, being able to advocate on our behalf in some of these hospital spaces so that we can continue to be there for our clients.
I just want to extend a large thank you to each of you, the panelists, also the audience, for tuning in for such a phenomenal conversation. I know we're not, physically in the same space, so virtual claps and snaps. And I think Naomi put in the chat that if you have any questions post this conversation, you can email those. But yes, thank you again. We appreciate you so much.